Welcome, everyone, to Cornell Keynotes. I'm your host, Christopher Wofford, and I am so pleased to be joined by Cornell Duffield engineering colleagues Gina Park, Haiyan Deng, and Tim Fraser. In January 2025, New York City launched the first congestion pricing program in the United States, which offered a rare, real-world test of how traffic policy affects air quality. And over the last year, this team led a study to measure the environmental impacts. Their team combined high-frequency air quality measurements across New York City with detailed data on weather, background pollution, and neighborhood characteristics. They used statistical methods designed to measure what air quality would have looked like in 2025 if congestion pricing had never happened. They used this to measure the effect of congestion pricing in its first 6 months. In today's conversation, these three will take us through what they found, why the effects look the way that they do, where the evidence is strongest, and where uncertainties still yet remain. We will also talk about what these results mean for environmental health, transportation policy, and the broader question of whether congestion pricing can work in other U.S. cities. Today's show is produced in partnership with the Center for Transportation, Environment, and Community Health, also called CTEC, at Cornell Engineering. And a shout out to our friend and director Oliver Gao for being the prime mover behind today's keynote. Viewers, will take your questions in the chat throughout, and heads up for links to not only the study and the work that's being done at CTEC, but other resources that can help you learn more as we take you beyond today's conversation. So, Tim Fraser, I'm going to start with you. As congestion pricing was put into effect, how much did air quality change in New York?
Well, we saw that in Manhattan, in the congestion relief zone called the CRZ, we saw a 22% decrease in the amount of particulate matter, PM 2.5, the amount of smog that was being produced within that zone. The Environmental Protection Agency says that we really shouldn't be exposed to more than 9 micrograms per cubic meter of PM 2.5, this smog.
Over the course of what time?
An annual average exposure.
Got it.
And because of that, that's what makes the change from congestion pricing really significant. We went from a projected 13.8 micrograms had congestion pricing never occurred to 10.8, which is a 3 microgram drop. That's a huge amount of scale. It's still not at 9 micrograms per cubic meter, that EPA goal, but that's pretty good, right? That makes a sizable change in air quality within that part of the city.
So a point of focus is Manhattan. What happened in some of the other New York City boroughs? And also let's think about the Cross Bronx Expressway, which is a significant source of congestion, right? What did you see in some of the outer boroughs?
We also saw a sizable reduction in other boroughs, not just in Manhattan. The numbers are like slightly lower than the main congestion relief zone itself, but it ranges from 16% to 10%, and so it's a pretty good improvement overall. In terms of the Bronx Expressway, would you like to?
Sure. Well, we looked at 3 broad areas of New York City. There was what was the effect in the congestion relief zone itself inside Manhattan, and then there was what was the effect within the 5-borough area, and then also what was the effect in the entire metro area that spans out through Long Island all the way down into New Jersey. And we found that there was a 22% drop within the congestion relief zone, but there was about an 11% drop within the New York City 5-borough area. And in the Bronx specifically, which you were asking about, we saw a 11% decrease, pretty on par for the rest of the 5 boroughs. And then moving out beyond that, we still saw a decrease too of about 7.7 micrograms per cubic meter, which is
across the river into New Jersey.
Across the river into New Jersey.
So let's talk about PM, this recurring index that we're going to be using throughout. Can you explain a little bit about what it means and help us understand it, make it a little more palatable for us that don't work in this space?
Yes, absolutely. So PM is a very fine particulate matter that is not, you can't smell it, you can't feel it, but it's very small. And if you're exposed to this for a very long time, then it could actually be very detrimental to human health. And so it's one of the main air pollutants that we want to make sure to decrease it, right? And so it is highly related to many different emission sources, but when it comes to transportation, it is contributing a lot, and it creates a lot of smokes. And if that goes for a long time, that could create asthma or any long-term respiratory diseases. And so it is really important for us to make sure that we have low or non-PM.
So go ahead.
Well, you might wonder who is vulnerable to changes in air quality.
Yeah.
And I usually say it's young kiddos with asthma, young kiddos, anyone with asthma, the elderly, but it also affects just anyone who's out about their day, doing vigorous exercise. If you're jogging in Central Park, this affects you.
Mm-hmm. Got it. Hyen, I want to pivot over to you. I want you to tell me why cities might consider congestion pricing.
Congestion pricing is working as a market mechanism to regulate traffic to solve the problem of overconsumption of public goods. So from the economic point of view, if the road is a limited resource, and if the people who are using the road is not bearing the full social cost, then they tend to overuse it. So in that case, that will cause a lot of problems like gridlock and pollution and health problem, as my colleagues just mentioned. This is also a classic example as comments of tragedy for commons in system dynamism point of view. So we have seen that in the world, and we will talk about that in more later.
Good. I have some question about the factors that go into congestion pricing. Some that are mentioned are public transit, ridership would be a factor, traffic time, maybe overall projected revenue from the program. How do you draw the connections between all those different things when we arrive at a congestion pricing policy?
So though this is a deeply interconnected system, can I move on to the next slide, please? Yes. So people, when there's a toll pricing, then people's driving behavior will change. So they have multiple choices. They can avoid driving, take the transit bus. They can drive into the city by carpooling, or they can still bear the cost, drive into the zone, or they can deviate. They can go to the peripheral area and go to their destination. So therefore, we connected all those factors into this system. We try to tackle the structure beneath the ocean level, to tackle the iceberg structure, and to see what are the quantitative relationships between them. So this is the causal diagram that I connect all those factors together instead of they are just individual observations. So then we were going to use some simulation and to simulate the result.
Thank you. So congestion pricing, Gina, I want to turn to you, is not entirely unique to New York City. This isn't the first time. There are other examples. Can you speak to where else this might have been implemented around the world and what the results were?
Yeah, certainly. So as you said, it's a long-established policy. It's not New York City is the first one who adopted it. Mm-hmm. We know that especially the European cities like Milan, for instance, they experienced about like 17% reduction in terms of particulate matter 10. Actually, that's a little bit of the detail that I wanted to share with you. We observed particulate matter PM 2.5, which is the size of the diameter of the matter. It's very fine. But these other cities that I was just mentioning, Milan or London, for instance, they had reduction of 10%. They all had PM 10, which is slightly bigger than PM 2.5, which means that New York City actually has experienced even stronger impact in terms of air quality because it's 22%. but it's also 22% of PM 2.5.
The worst kind of smog.
Exactly.
Yeah.
So New York City has experienced especially stronger impact compared to these other cities that I was just mentioning. And the reason why I think that might have happened is because, New York City is more dense. There's such a high density, and these Manhattan and congestion relief zone, especially if you think about it, transportation and traffic is one of the biggest source of air pollution compared to other cities that we perhaps have mentioned, compared to density and so. And so we believe that maybe that's why it had, had bigger impact than these other cities.
So there are also other cities that have the congestion pricing. The earliest one is Singapore. They started in 1975 and upgraded to automatic system in 1998. So they see, when they started the program, they see immediate reduction in traffic at 30%. And then London, which is regarded as a good, successful example, launched the congestion pricing in 2003. And they have seen 30% traffic time reduction, and they raised the money from the congestion pricing from the fee and reinvested back to the public transit, which is a successful example for other cities. And then Stockholm, and after they imposed the congestion pricing, they have seen reduction of asthma-related hospital visit by 50%, which is a huge success. Yeah.
And so I think what's exciting about this is, although congestion pricing has been implemented in several other cities throughout the world, this is the first time it's ever been implemented in North America. Certainly in the United States. And so there was kind of this question hanging out there for a while. Will it work? Is congestion pricing just for Europeans? And that really does not appear to be the case. We saw, environmentally speaking, and in terms of health impacts, it's had a rather substantial effect in New York City. So the tagline I like to think about is congestion pricing not just for European cities anymore.
There you go.
Coming to your neighborhood.
Yeah. I want to get back to the measurements, the PM 2.5. The study focused on the daily maximum versus like an average or hourly. What does that mean when we talk about the daily maximum? What does that mean for health impacts? Why would you look to that?
Sure. Well, the daily maximum is that point where the air is at its worst quality, right? And so if you have a health condition, if you have asthma, if you're an elder, if you're an infant, if you're doing vigorous activity, if you're working construction, any of these things, and you are exposed at that point, that's not great, right? That's where it's going to impact your health the most. And so we wanted to see, did congestion pricing bring down those points that would have the worst impact on human health? But I should mention, we redid the study again using the daily average as well. So the average amount of PM 2.5, and the results are fairly consistent.
Okay, good. Yeah. Thanks for that clarity. I want to ask you how you separate pollution from transportation versus other types of pollution. You had a upwind monitor situation going on there. Explain how that worked.
Yeah. Well, for that, we call that the background concentration. That's the idea that Gina was referring to.
What does that mean?
That means that even without cars on the road, your city is still going to be producing PM 2.5 from all of the buildings and all of this that are outputting, that are doing heating. And so we need to account for that. We need to make sure that we wean out of our statistical models any trace of the background concentration so we can find the true effect of the congestion pricing policy on air quality. So we were able to look at monitors that were upwind of the monitors that we were assessing, thanks to this huge set of monitors deployed by the, I believe it's the New York City Community Air Survey, as well as airnow.gov, a federal operation for air quality monitoring. And these were able to tell us hey, in this area where that's upwind, what's a good approximation of the air quality without taking into account transportation levels in your current area?
Yeah.
I got it.
To
Go ahead.
add on just a little bit more scientific details is that particulate matter is essentially a mixture of different particles together, and so it is created by chemically reacting to each other in the air. And so just like how Tim has mentioned, even though we don't do anything, it exists on the ground. So there's a ground level and there's also up in the air level that we also have to measure. But anyways, and so because of that reason, it's very important for us to take that into account, that we separate that baseline impact from the existing PM 2.5 as opposed to what exactly has increased after adopting, or decrease, like what is the change after the policy adoption?
Perfect. Gina, I do want to stick with you. The study reports that PM 2.5 reductions inside the congestion relief zone, the CRZ, actually grew over time, right? So the reductions kept going in that direction. Why did that effect grow? How do you think that happened? How do you account for that?
Yeah, that's a really important question, Chris. We believe that there has been a compounding effect. As we mentioned, there are so many different factors that are impacting, especially when we look at the traffic, for instance, after CRZ, after congestion pricing has been adopted, people have changed their behaviors to different timeline, or they were taking more metro or public transit. And so there is a behavior adaptation, and also overall traffic has decreased by, what was the number? Was it 11%? I think it was. Overall traffic has decreased after congestion pricing was adopted. And so all of these different factors had compounding impact, and so it has contributed to the fact that the effect has been increasing. These different aspects, 11% of the traffic, it's not 1-to-1 ratio. Just because the traffic has decreased 11% doesn't mean the air quality has decreased 11%. Because, again, there are different factors are coming into play together. And so we believe that these behavioral adaptation and also compounding effects has, put into that, growing effect.
I have a question for you. I want to talk about methodology here.
Love that.
Why did you elect to build a model instead of using something like a simple year-over-year comparison? Explain that to me.
Yeah. Well, this is the big question, and we love this as statistical modelers. If you compared year to year, which some studies have done out of an effort for data transparency, right? It's very approachable to do the average 1 year versus the average the other year. But each day, if you take Monday in January of 2024 and a Monday in January of 2025, there are different factors that were also shaping air pollution on those 2 days, and we need to account for them. So though the weather was different,
Sure.
temperature, humidity causes PM 2.5 to either stick in the air a little bit more or not. We also need to adjust for things like literal daily differences, the effect of a Monday versus a Tuesday versus a Sunday, right? We also need to adjust for that background concentration we talked about, but we also need to account for things like the wildfires. Right?
Sure.
The Canadian
Right.
wildfires, which have impacted air quality in the Northeast so much. And so each of these dynamics can be, we call it controlled for in our statistical model, so that we can create a what we like to call an apples to apples comparison. Can you show me what would air quality have looked like had congestion pricing not occurred over time, and then what did it look like in actuality? And so that way we're able to create this counterfactual is what we call it, and compare the two.
Gina, any follow-up on that one? I know you lit up when I mentioned modeling. Happy to pass. If you want to.
I think Tim has covered enough.
Okay, good. Well, I want to ask you then, how certain are you about the findings as it relates to the effects of congestion pricing? Any uncertainty? How do you account for it? How do you describe it?
Well, I guess there are two types of uncertainty we could be talking about here. One of them is the estimates. So as you can see on that graph, if you look really, really closely, there are teeny tiny error bars around each of those bars. And that is describing the 95% confidence interval for these effects. And that is great news. That means that we drew from a huge sample of air quality monitors, and our estimates have very, very little uncertainty. The other kind of uncertainty that you might be thinking about is, well, this study looked at the first 6 months. What happened after that? Mm-hmm. That's still a little bit unclear, and our team is working on it. And so we've got more results coming soon, but we are hopeful, based on that time trends that we saw before, that things are getting better. Haiyan, do you want to add anything?
Yeah. So thanks to Tim that for tiny little error bar. So we based on the foundation they built and then carefully calibrate our new system dynamics model. So to make our model and then validate through other methods. And so to simulate from 2023 to 2031. So use the calibrated model to predict what's going to happen when the toll pricing goes up from 9 to 15 to 18. So using the system dynamic model that interconnected whole holistic system. So that will complement our current publication.
When can we anticipate seeing the results for the next 6 months?
We have a preliminary result now, but
Coming soon.
Coming soon.
Yeah.
Okay, good. All right, we'll stand by for that. I want to return to a statistic that was cited earlier. I can't remember where it came from, but congestion pricing reduced vehicle entries into the congestion relief zone by 11%. But the PM 2.5 was reduced to 22%. Sorry, staggering statistic there. How do you account for that? What happened?
As I was previously mentioning, there are different effects that are coming into play and had a compounding impact. And so small reduction from traffic, 11%, I shouldn't say small, but 11% of traffic, that is likely to contribute to nitrogen dioxide, which is another pollutant that contributes to overall particulate matter. That typically accounts for 30 to 45%, according to some studies, to overall particulate matter level. And so there has been that 11% of traffic has impacted an overall particulate matter level. But there is also other types of reduction impact. As I said, people are more traveling at different times so that there's less congestion. They're taking more public transit. And so all of these other behavior adaptation and traffic changes had a bigger impact later on. So as I said, it's not one-to-one ratio. Yeah.
I'm thinking about that plot that we had up here, up in the upper right-hand corner. Can our viewers see that?
Yeah, sure.
There is, the upper right-hand corner shows the change from January to June in how many multi-unit trucks entered the congestion relief zone. And you can see it's a quite steep decline. Now, anyone who's been behind an 18-wheeler on the highway knows that not great for air quality, right? Not great. So imagine if you can take one of these off the road. That has a huge impact. But if you can take several of them off the road concurrently, as Gina said, that effect compounds. Plus, ideally we want to change the number that are on the road, but even if we change when they're going on the road, that matters too. If we can do anything to reduce the big clumps of 18-wheelers all on the same road, all at the same time, if we can spread them out, That seems to be happening right now in New York City. There's a lot of anecdotal evidence that truckers are driving through late at night so that they can avoid impacts from the toll. And that way, you're able to just by adjusting the when of your delivery timing, businesses are able to help contribute to the benefits of congestion pricing on air quality.
Gina.
I want to pick up on the point that Tim was mentioning, that time matters. Because PM 2.5, this particular matter, during the day, it changes, the level changes. And so it matters when PM peaks during the day. So is it the morning time? Is it the afternoon time? Is it nighttime? So because of that difference too, it matters a lot that when we have this congestion, is it going to be during the day and in the night? Yeah. That's another thing that I wanted to add.
If we can bring down the congestion, if we can just change when cars are entering, that makes a big difference. And if we can reduce the total number of vehicles and encourage people to use public transit or to carpool, great, right? Both of these are levers that we have open to us to improve air quality.
Haiyan, I want to think about behavioral economic impacts, some of the trade-offs of congestion pricing, right? What does that mean for, we use terms like equity. How do we think about the impacts of this, and what do we mean by equity in this context?
Okay, before I dive into that question, I'll give you some numbers. So before London launched their congestion pricing, 43% of the citizens in London opposed it. And after it imposed the fee, within a few months, that number goes down to 31%. So you can see, because the effect is immediate. And also in Stockholm, and that number was below 40%. So when New York City, the congestion pricing goes into effect, there are huge debate about this congestion pricing. People are talking about equity, unfairness, and so that's why.
But it seems to historically resolve itself.
Yes.
As people start seeing the benefits.
They are saying that some of the people twice going into the Manhattan Island and going into the traffic zone, going to city zone. So that's why we need to understand this problem with a complete picture, with a holistic view, that we can connect all the things together. So you can see there are balanced loops here. Most of them are balanced loops, but when the balanced loops, the feedback loops work together, that's like chain to another chain, sometimes they work as a reinforcing loop. So therefore, when we collecting the fees from the toll, we can use that money to improve the infrastructure, to invest the public transit, therefore make it more accessible to the low-income people and also more reliable. So which is a good, it's a reinforcing loop for the congestion pricing. So when we look at this interconnected system, when people understand the structure and also understand the benefits, I think this will help people to make better decisions and make better policies.
And if I might add, the big question is, well, if you're going to implement this big policy, how is it going to affect me as a resident, right? Am I going to see the immediate impacts? And the nice thing about this study is that it showed that some of those impacts you do see immediately, right? The air quality impacts picked up after the first week and progressed over time. We know that the stated goal of the congestion pricing policy is to help fund the MTA to the Metropolitan Transit Authority to improve public transit. And I think there's also that concern that even if it benefits residents, it's not going to benefit residents in certain parts. I think folks in New Jersey were concerned. Folks in the Bronx were concerned about the expressway. And at least based on that first 6-month picture, we can say that there are immediate air quality benefits coming to both of these groups that were worried about the impacts.
Gina.
I wanted to add a little bit on that. Some folks were very worried about whether there has been a spillover effect, whether these traffic decrease and congestion, has it moved to these other areas? And we didn't see that from our study. And so we don't necessarily believe that this has resulted in, it's not a trade-off between the decrease in Manhattan doesn't mean it is increase in other boroughs like Bronx and New Jersey area close to New York City.
And that wouldn't be good environmentally had that
Right.
happens, right? If you just exported all of the traffic down into New Jersey.
And then it blows across the river, and here we are.
Then no one would be happy, right?
Yeah.
Right.
Can I add a little bit on that?
Of course.
So I think, well, as I said, there is interconnected system. So there might be some diversion to the other areas, but we want to make the policy that direct people to make decisions to take the public transit instead of deviating. So that the policy, the toll schedule is important, like when and which kind of car, that kind of thing. And also I want to add is that the cost, the traffic and also the health, the cost to the traffic congestion to Americans is high. So in 2024 data, the average American people lost 102 hours annually in traffic jam. And the 2018 data that 87 billion GDP were lost because of traffic jam.
And think about what that translates to in people's lives. That's time with your kids. That's time, I don't know, out on a date. That's time, time to yourself, time for mental
your work.
health, time for all kinds of things. And we also know that that time you spend in stressful traffic jams, that impacts you. That raises your overall stress level for the day, right? So there are a bunch of ways that this. A bunch of reasons why we would want to change this as a society.
Right, and shrewdly you would think, oh, that's time that you could otherwise be productive. If we had to think about it
Companies
that way.
might think about it that way.
That's
Yeah,
what I'm getting
yeah.
at. And speaking of which, congestion pricing, Gina, I want you to talk about this a little bit. How do you think, or what have you observed, congestion pricing affects things like freight logistics, supply chains, delivery firms, a huge part of what it means to do business in New York?
I think it has impacted huge on these freight and logistics industry because they have a very tight margin in terms of their pricing. And so this toll is a huge impact on the overall pricing. And so they probably have derouted or changed the delivery schedule, of course, because of that impact. And
Which is inconvenient.
Yeah.
But probably a good thing, because otherwise there's no pressure. There's no pressure to keep New York residents safe, so to speak,
Right.
from the impacts of traffic.
Yeah, and this matters a lot in terms of the air quality too as a result, because these trucks, when they are delivering, they don't turn off their engine. They are actually idling.
Yes.
And so while they are making the delivery, the emissions continue to be emitted in the air. And so the traffic, because these trucks are not delivering and moving around this time, and it's not just driving emissions, but it's also idling emissions that are impacting the overall air quality. It has a huge, there is a huge impact on overall air quality, yeah.
That's good.
What did you observe among different types of vehicles as it relates to PM 2.5? Can you tell us a little bit about that? I'm sure it figured into it.
Yeah, so overall, we told you about that overall air quality, overall traffic has decreased by 11%,
Yeah.
especially the trucks. The multi-unit trucks, they have decreased about 18%, right? And that means, just like how I was saying, they chose not to drive during that time, right? They have decreased the overall quantity, and so that has impacted a lot. Do you want to add a little bit more on that?
Yeah, I'm remembering that the Metropolitan Transit Authority recently published some statistics that said that the overall number of trucks entering that were on the road in New York City hadn't fluctuated much in the past year. But within the 6-month period that we were looking at, we did see very large changes using their own data, using MTA data. And so what I'm gathering is that maybe their analysis looked at different sections of the city or a bigger picture. It could be that these trucks are rerouting within the city to avoid, or it could be that because that was about trucks in general, that doesn't closely capture the behavior of the most highly polluting trucks, the big 18-wheelers, the big multi-unit trucks. And those are the ones that we saw a big decrease in.
That's a really important factor that is related to vehicle type too. Just like how Tim has mentioned, these trucks, they are usually diesel engine trucks, and their emission factor is so much higher than other passenger cars. And so it is a huge impact just by looking at the heavy-duty and multi-unit trucks, whether they have decreased or not, in overall air quality. Yeah.
And so it's neat because this gives us, I'm going to return to that word, levers. This gives us a number of different levers that New York City can continue to adjust over time. I know there are some cities who implement a version related to congestion pricing where they just price entries for trucks. And imagine if you are another city in the United States and you think you want to try out congestion pricing, but you're not sure you can do it for all cars. What if you can do it for trucks? Right? That can make we expect can make a huge difference. There are a number of different styles that you can use. And it really, I think of this as an exciting moment for experimentation throughout the country, ways that we can make policy work for the public, right? Ways that we can improve our transit systems.
You just said about the certain type of vehicles. I think Milan did that. They started to just for the heavy. I think they have the toll for the very old car because the pollution.
Yeah.
Then people started to get rid of the old car, buy the new car, less pollution, and later on they transferred it into all cars. So when the city started to consider congestion pricing, they can do some experiments based on their situation.
Absolutely.
Yeah. Hi, Ann, I want to follow this up with, I want to ask you, are there other U.S. cities that may follow New York's example, either based on your study or otherwise?
There are many big cities that is watching closely. The typical one I'm going to talk about is Boston. They published their white paper December 2025. It's just a month old. So they have this hypothetical zone. They want to charge the traffic, the zone toll. So they do this simulation, and can we see this? Yes. So the blue line is the decrease in traffic. The red line is increase in traffic. The thickness is the magnitude, how much it increase or decrease. So you can see that through the simulation that around this zone that they want to control traffic, the traffic volume decreased a lot. And can we see the next slide, please? The next slide. So the result is that they look at 2 different scenarios. If they impose $9 or $15, what's the impact? So the vehicle travel decreased by about 12% to 18%, and the vehicle miles traveled decreased by 26 to 31%, and vehicle hours traveled, which means you gain your time back, decreased from 37 to 43%, and the PM 2.5 decreased by 1.3% or double if you increase the toll. And there are other cities like Chicago, like San Francisco, like Los Angeles. They are all doing similar researches in earlier years in 2020 and 2022.
I mean, just those numbers you're referring to about Boston, it makes me think, as a former Boston resident, I didn't want to drive in the city as much as I could. Because of how much traffic there is, there's a moniker for people who drive on the Boston highways, right? Mass holes, right? Because it's tough. It's really hard and it's really stressful. And so imagine what that, if we see those changes, what a 26% projected drop in vehicle miles traveled, imagine what a change that could make for your experience driving through these cities.
Yeah, your speed goes up. You can get to your destination earlier. I drive to Boston a lot because of hockey tournaments. So when there's a game, I'm like a rush, and all the traffic on the road makes me so stressed.
Yeah.
Can other American cities, U.S. cities, anticipate similar results as New York City? I mean, New York feels like a special example, but we did just mention L.A., right? Very different than Boston, very different than Chicago, completely different layout, transportation scene. Can they anticipate seeing results that are as impressive as this?
Can I just go first?
Yes.
Okay, so I think the first thing is that you need to look at your local area, whether you have a reliable public transit system, and whether it's accessible. Because if you increase the traffic, the congestion price, increase the toll, but if the public transportation is not accessible, that is an equity problem. So people who has a low income, they are hit twice, and it's hard for them to get to where they are. So that's so you have to have a reliable public transport system. Another thing is that it's very important to use that collected money back to the public, to promote the public transportation system, to improve the infrastructure. That will also help to alleviate the equity problem concerns.
It makes me think about what are good candidate cities for this, and just like Haiyan said, right? It's cities with a public transit system that routes inwards to a highly congested area. So I think of places like Chicago, San Francisco, Boston, Philly, even Pittsburgh, right? And as long as you have those routes for people to take in, and you have congestion, I mean,
I don't
it's like
want to
a good match, right? Might as well try. If New York City, one of the most congested places in the world, can pull this off and see benefits from it, I mean, that seems exciting to me.
You know, you did some of your studies. I'm a curveball here.
Yeah.
You mentioned that some of your studies were done in partnership with the Metro Transit Authority. Do they have something similar going on as it relates to user adaptability, as it relates to congestion pricing?
Our studies were done using some of their publicly available data, so not in partnership with.
I see.
They did a one-year summary study of New York, of NYC air quality and congestion pricing that I encourage you to check out. They did use the comparison of annual averages, which is why we encourage people to take a look at our methods and try to use those kinds of methods when making these comparisons, because we would say that 2024 and 2025 were fundamentally incomparable, and that you really need these kinds of statistical models to do a good, clear comparison.
Okay, and in checking out your methodologies, I do want to encourage our audience to check out the article that was published in Nature, I believe, right? And there's some resources that you can check out as well from the Center for Transportation, Environment, and Community Health at Cornell. Gina, Haiyan, Tim, thank you three for sharing your expertise, your research, your insight into this study. We really appreciate you coming by Cornell Keynotes today.
Thank you.
Thank you.
Glad to be here.
Yeah, it's been absolutely lovely. So thank you, viewers, and we will see you next time on Cornell Keynotes. Thank you so much.
Thank you.
Thank you.